Chandra, thank you so very much for this opportunity to learn from you. I would love for you to get started with introducing yourself and the work that you do.
My name is Chandra Clark. I'm the Executive Director of the VHL Alliance. The VHL Alliance is a nonprofit organization, and we are dedicated to research, education, support, and awareness to improve the quality of life for those who've been affected by the rare disease VHL, also known as von Hippel-Lindau. VHL is a rare genetic disorder. So as you know, there are over 7,000 rare diseases, so it is one of many. It can cause tumors in up to 10 different parts of the body, and those tumors can be benign or malignant.
Currently, there is no cure for VHL, and there are no non-surgical treatments available.
And it affects 1 in 36,000 Americans, and it does not discriminate against race or socioeconomic status.
And with the complexity of rare diseases such as VHL, how does one know that they may have VHL? What are some of the early signs?
VHL requires a specific type of expertise. So part of what we have through the VHL Alliance is we have a partnership with what we call clinical care centers. So throughout the country, we have centers of excellence that we can refer our VHL patients to. So domestically, we have 36, and internationally, we have 12. And so VHL patients require ongoing surveillance in treatment. And again, it has to be a physician who is an expert in VHL care. And some of the symptoms that they may face will be things like headaches, body aches. Sometimes it's not really detectable unless they're meeting with the physician that can, have the insight to test for a rare disease like VHL. But also when it comes to kidney cancer and pancreatic cancer, those cancers can come possibly because
there is a mutation in the VHL gene. Every human being has 2 copies of the VHL gene. People with VHL disease have a genetic mutation in one of the copies
that has ultimately led to those cancers. So any of the symptoms that are related to kidney or pancreatic cancer can also be what alerts a doctor to look for VHL.
When we speak about clinical trials specifically, why is it important for diversity in clinical trials for diseases such as VHL?
That is a wonderful question. So it's so important for clinical trials in rare disease, especially when it comes to minorities, because representation is so important. So, clinical trials, they enable doctors and researchers to study the impact of new modalities on patients that often have limited treatment options. So the way that they can gain new information is from studying how these new treatment options affect these patients. So without having minority representation, then it's really hard to say how these treatments are actually affecting all patients. And it's just so important too, is we're looking for advances in medicine, that there is diversity in every aspect. So without minority representation in clinical trials, we can't really say that we're advancing and having the treatment that is equal to all people.
What advice do you have for folks to be empowered in their narratives, whether they're living with VHL or any kind of chronic or rare disease?
I would say empower them to use their voice. I had the opportunity 2 weeks ago to participate in the advocacy meetings with congressional staffers on the Hill. This year, of course, everything was done virtually, but I had the opportunity to sit in firsthand and hear the stories from rare disease patients. And when you go back to this idea that we're all fighting for quality of life, it is so important that those who are dealing with chronic illnesses speak up and talk about the need for funding, to talk about the need to have the research and the resources in place to find a cure, but also to speak about the need for them to have support in their day-to-day life. So having equity in healthcare, having the encouragement to know that if they go to a facility, that they will be treated with the utmost respect and have the same quality of care as anyone else. When you're talking about things in regards to access and complications with insurance, these are all things that can really be detrimental to someone who doesn't feel like they have a lot of support and they're again fighting for their quality of life. So we need patients to speak up. We need patients to talk about the adversity that they're facing, to talk about the need again for equity in healthcare and fairness, to talk about the need for access. We need to talk about diversity, equity, and inclusion. It is not just about race. It is not just about social economic status. This is about human capital and just treating all humans equally. And so a rare disease patient there's power in them using their voice. And I could say that, I am the new executive director to the VHL Alliance. So to have that opportunity to hear from other rare disease patients really empowered me to say, this is what I have to do as the leader of this organization to make sure that we're on the forefront of bringing awareness to not only VHL, but other rare diseases, and utilizing our platform to help amplify our patient voice. So really providing them with the support that they need to go forth and go to Congress and say, hey, we need funding, we need support. Rare diseases are real and there has to be change.
Where can people learn more about you, your work, the VHL Alliance?
People can learn more about the VHL Alliance by visiting our website, which is www.v as in Victor, H, L as in Larry.org. And there is a plethora of information there about our work, ways that, patients can utilize our services, and of course, gain support from our organization, but also for those who are interested in becoming volunteers, donating financially, and just learning more about rare disease. And also May is VHL Awareness Month. So I would really encourage everyone to go to our website and learn more about some of the activities and events that we will have as we really gain to broaden our reach in bringing awareness to VHL. And one thing I want to say, Christine, is that VHL, our vision is curing cancer through VHL, because if we can find a cure for VHL, it will lead us to finding cures for other cancers. So our organization, we are very passionate about research and advocacy, education, and awareness. And with that, we also want to partner with other organizations that are also passionate about the diversity, equity, and inclusion element in all of this, because we know that we are better together. We want to be collaborative, and we really want to work with the community as we seek to find a cure for cancers.
Wonderful, Chandra. Thank you so very much for educating our viewers and myself on the VHL Alliance, the VHL, on people who live with rare diseases and what it means to be an empowered patient. So thank you for your time today. It was truly an honor, a pleasure to speak with you.